Start worldwide, the number of coronavirus cases has now passed the 3 million mark. In Canada, more than 47,000 people have tested positive, and more than 2,600 people have died in Canada. Here's your map now, province by province. There are now almost 2,000 cases in British Columbia. Quebec has close to 25,000 confirmed cases. No new cases have been reported in New Brunswick and Prince Edward Island as well in several days, so that's good news. Ontario, though, now has almost 14,900 known infections, with 424 new cases reported just minutes ago. And while we talk about Ontario, it remains one of the hardest hit provinces, as you saw. But Premier Doug Ford is today expected to unveil plans for reopening Ontario later on today. The Premier is going to detail the province's framework to restart the economy, to relax some of the current lockdown restrictions this afternoon at 1:30 Eastern Time. Doug Ford has already stated that his approach is going to be gradual, it's going to be measured. Meantime, the province's education minister announced on Sunday that publicly funded schools won't reopen their doors until at least May 31st, and he warns that school closures could be extended further if that is recommended by health officials in Ontario. We have coverage on possible schools opening in Quebec. Raquel Fletcher joins us from Quebec City. We have Mike Lecouture, who is in Ottawa, who's going to give us the latest on the Prime Minister's address. And Crystal Gomansing, our Europe Bureau Chief, is going to be updating us on the latest information from the UK as Prime Minister Boris Johnson returns to work. We'll get to all that in just a minute, but let's start with Mike. Mike, what are we expecting the Prime Minister to focus on today?
Yeah, expected that he will talk about that wage subsidy program. It's been announced, it seems, weeks ago, but now we are finally in the thick of it. This is today when all of these businesses can apply for it. Started at 6 a.m. Unlike the Canada Emergency Response Benefit, which targeted individuals, this is not on a first-come, first-served basis. So if you're a company watching this or a company owner watching this and saying, oh, I should have applied at 6 a.m. this morning, don't worry. All of the applications will be processed at the end of the week, May 3rd, with expecting a lot of these. Actually, it's going to be on May 4th, and expecting a lot of the checks and the direct deposits to go out May 6th or 7th. And this wage subsidy, don't forget, is 75% of an employee's wage, which will be paid by the federal government, up to $847 per week. And of course, that's backdated to March 15th, and it'll go forward until June the 6th. And the Prime Minister really wants to sort of talk this up, making sure that a lot of businesses are taking advantage of this. We know they've been hit hard. A lot of them have been closed since March the 15th. Difficulty in this, though, is we're hearing from the Canadian Federation of Independent Businesses, who, while applauding this, saying it might be a little too late, because at this point, if a company has not been able to survive from March 15th until today, it's unclear if they'll be able to hire back those employees that they may have had to lay off, or if the reduced schedule and the reduced hours that this company has had can turn around and they can possibly reopen a little bit now. So that is some of the criticism that is coming from this program. But we expect the Prime Minister to underline this, while at the same time probably getting a lot of questions about reopening, because as we saw over the weekend, New Brunswick's Premier Blaine Higgs talked a little bit about relaxing some of the restrictions there. And as you said, we're going to have Doug Ford later on today, Farah. So expect the Prime Minister to be asked about that as well.
Yeah, actually, let's talk about that for a second, because there's mixed messages from provinces on reopening, and national guidelines were also discussed at last week's First Minister's call. I believe that was on Friday. So when could we see them, and what would they look like?
Yeah, and that mixed message really kind of comes from every province in a different posture, as the Prime Minister had put it last week, and trying to bring everybody either along together or at their own speed. The Prime Minister has said, look, we'll let provinces go when they feel like they can. You saw New Brunswick, as I said, over the weekend. Last week, Scott Moe, the Premier of Saskatchewan, laying out their plan. At the same time, on that call with the First Ministers, the Prime Minister talked about guidelines that need to be hammered out, making sure that while they are flexible to each province, there has to be a national standard, making sure that they are respected and anchored in the recommendations of the Public Health Agency of Canada, ensuring that everybody is doing the same thing, even if they're doing it at different times. So as we said, Blaine Higgs, the Premier of New Brunswick, talking about opening up your family bubbles, so to include another family. If you're a family of 5 and you've been limited to just being the 5 of you together, if you've got neighbors that you want to play with or that kind of a thing, then you can open that up, but you can't change the bubbles and interchange different families as you go, depending on who's available to play and whatnot. So they want to make sure that every province is going in the same direction with those same type of standards, even if there is that built-in flexibility that they will want to give these provinces to ensure that they go at the level that they want to. At the same time, as we've heard over the weekend, Dr. Theresa Tam talking a lot about, look, some of the provinces, as you know, Premier Francois Legault has mentioned, herd immunity, sort of helping them open sooner, and that herd immunity is if a good proportion of the province has already developed COVID-19 and as a result possibly developed the antibodies to it, that they may be able to go a little quicker. Theresa Tam was saying, well, look, the difficulty with that is that it's not something that really should be undertaken just yet, and people should really proceed with an abundance of caution. To that end, the WHO on Friday said there was no evidence of this type of immunity once you get COVID-19. They're not sure whether or not you have the antibodies or whether or not you can get it again. And then on Saturday, they revised that, saying essentially that, there's a little bit of immunity that's developed, some level of protection, as they put it, but they really want to make sure that once they sort of pronounce on this, that everybody understands it. So it's not a moving target, so it's not changing guidelines as they go.
Mm-hmm. Well, there's so much confusing surrounding everything that's happening right now. So every time they change things, that leads to more confusion. Mm-hmm. Thanks for that, Mike. We talked about herd immunity, and the controversy started with Francois Legault, the Premier of Quebec, who mentioned that, and there's still so much controversy around it. But we're going to bring in Raquel Fletcher. And Raquel, what I want to ask you about is something else about the Premier, because he's expected to announce plans for the province's reopening, which includes, and parents are paying close attention to this, trust me, a phased back-to-school plan. What do we know about that?
Yeah, hi, Farah. Well, as Mike mentioned and explained the controversy around herd immunity, we're expecting this afternoon for the Premier to announce this plan and give us the details. Now, parents, but not just parents, also teachers, school boards, unions have expressed their concern with kids going back to school this spring, saying, we don't want to use our kids as guinea pigs. And the Premier has staunchly refuted that this is what the province is doing. He says he's concerned about sending 1 million kids back to school in September, all at the same time. And so that's what he's trying to avoid is, potentially another wave of, students coming into contact with the disease and then spreading it to their parents or their grandparents in particular. And so that is kind of what last week he has sort of been preparing us for. Now, even though he's talked about herd immunity and there are some concerns about whether or not that applies to COVID-19 because it could be more like a flu, in which case you can get the flu multiple times. There are still many, many questions, and I think you alluded to that far as saying parents are paying close attention because these questions haven't been answered. The idea of physical distancing, well, how does that work in a school setting? The Premier has also said, it's not going to be mandatory. If parents don't feel comfortable, they don't have to send their kids to school right away. So then what does that mean for those kids who are staying at home? How will they keep up with their schoolwork? The other thing that is interesting is about teachers. It's not mandatory to send your kids to school, but what about the teachers? And there are a lot of teachers who might have underlying health conditions or are older, in their 60s, and they're concerned about going back to teach. Also, what is the long-term plan? If there are different waves that are going to be coming at certain times throughout the next school year because we're still all waiting for a vaccine, well, what's the plan to replace teachers who get sick? Or, what do we have to expect going forward?
Yeah, that's certainly a question also parents have in terms of this homeschooling that's going on and the sustainability surrounding that, working and trying to teach your kids at home. I want to focus now on the worst place in the country, I think it's safe to say, and that is long-term care homes in Quebec that continue to grapple with outbreaks. In fact, there's one residence in Laval where 85% of the residents have the virus. Raquel, is the situation improving at all?
Well, that's what we're hoping to hear from the Premier this afternoon. Obviously, they called in the military, so we want to know where those soldiers are going to be placed, what they're doing. There was also a number of calls last week for healthcare workers who are, staying at home because they are afraid of getting into contact with the virus, for them to come back. We heard that there were 9,500 healthcare workers who are missing from the system, and 5,500 of them are apparently healthy. So if we can get some of that personnel back into the system, but they've had a lot of trouble getting people into those homes, and that's what they need. They need boots on the ground.
Okay, and that's the care also at long-term care homes in Ontario. Thanks for that, Raquel. That's Raquel Fletcher, and we'll have you standing by as we wait to hear from the Prime Minister. Here again is that cottage door, the Rideau cottage door. We're expecting to hear from him in about 5 minutes. But while we wait, let's take you across the pond, as they say. UK Prime Minister Boris Johnson, he is back to work after recovering from COVID-19. I want to bring in our Europe Bureau Chief, Crystal Gomensing. She joins us now from London. Nice to see you, Crystal. The UK Prime Minister addressed the nation for the first time in weeks. What was his message today?
Yeah, he was back at work after, of course, recovering from his time in hospital. He was, in fact, in the ICU at one point. He was discharged, as people might remember, on April 12th. This morning, he addressed the nation, basically telling everyone, I know you're anxious. I know business needs to get back, but we're not going to do it just yet. He has been very open, and his government has been very open, saying they don't want to risk any progress that we've had so far with going back too early. At this point, the UK has had more than 20,000 deaths, and we talk a lot about deaths in personal care homes. We don't know the true extent when that number is included, because the numbers we get in the UK are only hospital-related deaths. So 20,000 is a huge. He basically said that he refuses to throw away the sacrifice and the hard work everyone has gotten to at this point with the lockdown, saying it's just too soon, that there is a moment of opportunity, but also maximum risk. And so he asked people to be patient, to continue to be understanding, but says it's just too early to reduce any of the lockdown measures that have been in place really since March 23rd, when he made the announcement late at night.
Crystal, let's talk about some encouraging news. We go over to Italy. We've seen deaths and new cases have dropped. The country revealed a cautious reopening schedule. Also, France and Spain, same thing. How are they all beginning to ease restrictions? What does it look like?
Well, right now it's kind of an interesting situation, because if you look at Italy, for example, more than 26,000 deaths. Spain, we know that it was absolutely overwhelmed. Their healthcare system just couldn't keep up, as the same kind of situation in Italy. It is a slow integrated start, a reopening. Italy, for example, started very slowly with a few shops here and there. They are expanding it out. In Spain, this past weekend on Sunday was the first time kids were allowed outside in 6 weeks. They are saying that they need to be measured, they need to be cautious. Most of these places will not have major reopenings. Restaurants are going to stay closed for a little bit. Takeaway restaurants in Italy, for example, will reopen, and families can start to visit one another, but they have to be very close, and there's no large gatherings at all in Italy. People are allowed to travel within municipalities, but you can't travel to different regions, so there still is a lot of concern, and they're doing this in a very cautious, measured approach, because of course the fear is that second wave, that second hit, and these countries are still devastated by the number of deaths. And so we've been warned that the de-escalation of these lockdowns will take time, but it is starting to happen. And it's a challenge throughout Europe because every country has been sort of at a different stage. So everyone is sort of doing their own thing, and everyone else is keeping an eye to see how things are going.
I'm so glad you mentioned that, Crystal. And just so you know, we have the 1-minute warning for the Prime Minister, but I'd like to keep you until he comes on, if that's okay. Crystal, let's talk about that. Yeah. Denmark, for example, they a couple weeks ago opened schools. How has that worked? Could that be a model for us here as we talk about that in Quebec?
Well, yeah, we just heard Raquel Fletcher saying that politicians are concerned, parents are concerned that they want children being used as guinea pigs. In Denmark, we heard that from a number of parents. You know, they did reopen schools about, 2 weeks ago, April 14th, I believe it was, and it was for younger children up to grade 5. And a lot of parents didn't let their kids go. They were afraid of it. And so there is even there a gentle reopening starting with young kids. But it's important to note that with Denmark, they had fewer than 500 deaths. So a very different situation. But one of the big things that government and politicians will have to deal with is just an overall sense of fear. Is it safe to go back? What do you do? Especially with young children, it's not necessarily worrying too much about them being infected, but what about grandparents? What about parents? What about the teachers and all of those? And then just, of course, with kids, keeping them separate from each other is a challenge in itself. Social distancing. So we saw in Denmark with schools, pushing the desks a little further away, splitting up some classrooms. But we have heard from teachers there saying, listen, it's a challenge keeping them apart because they're young and they want to see their friends and be together. But there is definitely a challenge, even with just having small children return to school.
Okay.
A feeling of safety, and is it okay?
Thanks, Crystal. Here is the Prime Minister speaking now.
There are Canadians working long hours to keep each other safe and keep our country moving. But for everyone putting in an extra shift right now, there's someone else who wants to work but can't. Maybe you've been laid off because of the pandemic. Maybe you still have a job but aren't sure if your employer is going to keep you around next month. Whatever your situation may be, we're in your corner. Earlier this month, we introduced the Canada Emergency Wage Subsidy to help protect your job or help you get back to work. And as of this morning, applications for this program have opened. Employers can now submit a claim for the Canada Emergency Wage Subsidy through the Canada Revenue Agency. To access the 75% wage subsidy for your employees, go online through canada.ca to reach this portal. Whether you're a charity that employs 200 people or a fast-growing startup that employs just 20, you will be eligible to up to $847 per week per employee. And you can expect to see this money soon. The CRA has partnered with financial institutions, so make sure you register for direct deposit to get your money quickly. The first payments should begin to arrive on May the 7th. For organizations like Focus on Nature, who sent me a letter last week, that's huge. Because of COVID-19, this charity from Guelph would have been forced to lay off all of their staff. But thanks to the wage subsidy, they can now keep their employees on the payroll and keep teaching kids about nature. And there are so many more stories, just like this one. There have been over 300,000 views of the online calculator we launched last week to help businesses prepare a claim. And since the portal opened at 6 a.m. this morning, almost 10,000 businesses have already applied for it. That gives you a sense of just how many people this program will help. Right across the country, it's going to keep businesses and workers connected. And that gives people certainty that they'll have a job now and in the months to come to support themselves and their family. And it means employers will not just have the help to stay afloat through the tough time, but they'll be ready to gear back up when things get better. We all know a local salon or a gym that's had to close, a neighborhood restaurant or shop that's really struggling. And more importantly, we all know people who work there. They deserve a hand to get through this, and that's what the wage subsidy is for.
Since this morning, employers can make an application online in order to receive the emergency wage subsidy on the CRA site, and it is on the portal for the request of 75% of the wage subsidy. Whether you're head of a charity with 200 people or a startup with 20 employees, you could receive up to $847 per employee and per week. And this is money that you'll be receiving soon. The CRA has been working with financial institutions for the purpose of enable you to receive that money quickly if you opt for direct deposit as of May the 7th. And since 6 a.m. today, more than 10,000 corporations and companies had made a request, and that will help a lot of people to keep their job during the crisis, and will have also help employers to retool and start again once the crisis is over. So we all have a hair salon or a gym that had to close, or a small corner restaurant or corner shop which is struggling, and we know people who work there. So these people deserve a hand to go through the crisis, and that's the purpose of the wage subsidy. Obviously, one program and one program cannot help everybody. If you're a seasonal worker, or if you cannot find a job at the moment, we will be helping you. We'll be in your corner. And you may have received already your first monthly check for the emergency Canadian subsidy. And if you need it for next month, you can go online and confirm that you are still eligible for the emergency Canadian benefit. And so you do not have to, but you have to choose between one and the other benefit. As for students, we are working with other political parties in order to submit a bill and table a bill that will help you. We will be continuing our work in Parliament. The first virtual session will take it tomorrow, and a session in person will take place on Wednesday. And these people, everybody needs to be compensated.
Facing different challenges right now, and no single program can reach everyone. So we're coming at this from every angle. If your employer can't hire you back, if you're a seasonal worker, if you can't find a job right now, the Canada Emergency Response Benefit is there for you. You've probably already received your first check. And if you need the help again for the coming month, go online and reconfirm that you're still eligible. And I want to remind everyone, you won't be able to keep both the wage subsidy and the CERB. It's one or the other, not both. If you're a student, there's support for you too. Right now, we're working with the other parties on legislation to get this help flowing. Parliament will have its first virtual sitting tomorrow and an in-person sitting on Wednesday. And if you're an essential worker, you deserve to be paid properly for your incredible work. Our government is doing its part to make that happen. Ontario came out with their plan over the weekend, and we're working with them to provide the support they need to deliver results. And we're currently in discussion with all the other provinces and territories to get their plans for essential workers in place. I'll have more updates for across the country in the coming days. As I said Saturday, we're also collaborating on shared guidelines for reopening the economy once the time comes. Different provinces and territories will be able to move at a different pace, but we need clear, coordinated efforts from coast to coast to coast. And no matter where you live, you need to continue following the recommendations from public health officials that will keep everyone safe. Comme j'ai dit, On travaille aussi avec les provinces et les territoires en vue de rouvrir.
As I said, we are working together with the provinces and territory for a gradual reopening of the economies. We have to take into account the idiosyncrasies of each of the provinces and territories, but we want to guarantee the safety of all Canadians. We all want to go back to normalcy. However, we have to do it according to the rules. If not, we need to squander all the progress that has been achieved so far. So you know what to do. Stay home. Continue to wash your hands often, and if you have to go out, keep a 2-meter distance with the other people. And each day we're getting closer to the day, well, this crisis will be over, and we'll be able to celebrate together, but still we have some way to go. So let's persevere together, my friends. Thank you.
Merci beaucoup, Monsieur le Premier ministre. On va commencer la période de questions par
Thank you, Prime Minister. We have questions by telephone today. First question.
Première question, Raymond Filion, TVA.
Raymond Filion, TVA. Good morning, Mr. Prime Minister. Regarding the reopening of the economy that you mentioned, it will be taking place at various paces from one province to another. Are you going to close some regional or provincial borders in order to keep some kind of consistency from one province to another? Answer. I don't think this is necessary so far. People are complying with the guidelines provided by provinces and by the federal government and by our health experts. So they do restrict their traveling from one area to another, and they know how risky it is to resume our activity too quickly, because we might be wasting all the progress that has been achieved over the last few weeks of isolation. And all Canadians are aware of that, I believe, and we have also the tools that are necessary to make sure that they do comply.
As I've said from the beginning, I'm loath to use the Emergency Measures Act, and up until this point, it has not been necessary. I think people have been following the guidelines, instructions of public health officials, of provincial and federal instructions. People have been doing the things necessary to keep themselves safe, to keep their neighbors safe, to keep health workers safe, to limit their movements. We have measures in place that people are following as we reopen gradually. I'm certain people will want to follow these measures, because if we get this wrong, everything we have done, everything we have sacrificed over the past many weeks could have been in vain. We need to make sure we do this very carefully, based on absolutely the best scientific advice.
En suivi.
Have you read and have you approved the Ontario and Quebec plans that should be publicized today and tomorrow? And can you give specific examples of provisions such as wearing a mask or the plexiglass barriers between employees? Well, it is not for the federal government to adopt or approve the provisions made by the provinces. We do not want to impinge on the province's jurisdiction. And as you know, from one industry to another, from one region to another, measures will be applied differently for the purpose of maintaining Canadians' safety. So, however, what we establish in partnership with the provinces are basic principles, such as you must make sure that you have enough screening capacity if we want to reopen the economy, and we wanted to have specific provisions for some sectors of our industry. And so, however, provinces are perfectly entitled, and they are expected to as well to put forward specific elements which correspond to their own case.
Provinces have the authority to determine what is in their best interest. It's not up to the federal government to check or oversee the provinces in their areas of jurisdiction, and much of this falls within their areas of jurisdiction. They have the responsibility to do what is right for their citizens. Every province is in different situations. Regions within the provinces are in different situations, and I have full confidence in the premiers of the provinces and the territories to move forward in a way that is right for them. What we've been working on with the provinces is a set of guidelines and principles that can inform the decision makers in each region. Things like make sure that you have enough medical capacity to handle a potential surge. Make sure you're doing enough testing for your situation and have a plan to do more. Make sure that there are specific guidelines in place for specific sectors or industries that are appropriate to keep people safe. It's not up to the federal government to determine what those are. We have tremendous confidence in the provinces who very much want to make sure that this happens the right way and that we don't fall back into another phase like we're in this time as we gradually open up.
Thank you. Next question, operator.
Thank you. Merci. Next question, Mia Rabson, the Canadian Press. Line open.
Good morning. You already mentioned that the CERB and the wage subsidy can't both be received by people. How do you see them sort of complementing each other or working together? And are you not worried that workers are sort of going to be caught in the middle and many of them are going to end up having to pay one or the other of them back?
The wage subsidy and the CERB are designed to support workers, to support people who've lost their paychecks. For someone who's lost their job, whose employers can't hire them back with the wage subsidy, the CERB is there to give them $500 a week, $2,000 a month, so that they can pay for their groceries and make through this tough time while they're not receiving any sort of paycheck. But we also realized that it is really important for restoring our economic activity to full potential as quickly as possible that ideally people stay connected to their jobs, that they stay connected with their employers. And that's why we're facilitating a wage subsidy up to 75%, that is up to $847 a week, that will go through the employers so that people can stay on the payroll and stay connected to their job so they have confidence that they'll have that job when we have time, when we're at the time to come back as an economy. These are two different measures that aim to do the same sorts of things, make sure families and workers are able to make it through this time while doing the right things to keep themselves safe and to make sure our economy comes back strong. But it is one or the other. Because of the uncertainty, because of the application process, it is possible that people will have received both the CERB and the wage subsidy. In that case, they will have to, over the course of the coming months, pay one of them back. So people should keep that in mind, that if you're getting both, you should probably put one of them aside so that you can pay that back and you don't get overly challenged with that down the road. But we recognize that getting money out to people quickly and strongly, reliably, was the most important thing, and that's what we did. We'll figure out the next steps as we go and make sure that it's fair for everyone. Nous avions créé deux programmes pour aider ceux qui ont perdu un chèque de paie. D'abord, la prestation.
We have two programs to help people who have lost income. The Canadian Emergency Benefit provides $2,000 a month for people who've lost their jobs. But we did know that in an ideal world, people would keep their jobs, keep that link with their employers, so that they would be there when the economy opened up again. That's why we wanted to maintain that link, and that is why we brought in the salary subsidy. We will be covering up to 75% of workers' wages, weekly wages, up to $847 a week so that employers can continue paying their workers, so that when restrictions loosen and the economy is running again, people will still know they have a job they will be able to go back to. It is one or the other, however. Given the application process, it may be possible that some people have received both, but they should know that they will have to give back one of them, probably the Canadian Emergency Response Benefit. So if you have received both, do set one aside so that you can pay it back without difficulty later. The priority was to get the money out to people quickly and reliably, as quickly as possible, and that's what we did. Mia?
Do you envision then that many of the people who've already started applying for and receiving the CERB will suddenly be transferred over to the wage subsidy? And is that not very complicated? And are there sort of things within the program to try and prevent double payments so that there isn't confusion about who has to pay what back?
The government agencies have a clear record of who gets what that will obviously help in sorting this out in the coming months. The wage subsidy is retroactive to March 15th, but as of the date that the CERB came in, a number of people didn't know if or whether they were going to get an eventual wage subsidy, and so applied for it. The CERB is coming up on a reapplication moment, and if people are receiving that wage subsidy, they shouldn't reapply for the CERB, the Emergency Response Benefit. It is a situation that is complex, but it is administered by different processes within government that are clear to keep separate. If you apply through your employer if the employer applies for the wage subsidy, that money will flow for you, and you no longer need to apply for the CERB. You no longer qualify for the CERB. Okay. C'est une situation où on voulait assurer que les gens reçoivent de la.
We wanted to ensure that people would receive help and support quickly. That's why we set up the CERB. But once people receive a wage subsidy, they no longer need the CERB and will not reapply for it. We have fairly good systems within the government to know, so that we can see who's received what, and anybody who's received both benefits will have to repay one at some point. What we did do for now was to choose to send as much money out to people as possible during this emergency because people need support. We had to make some choices, and we made the choice to send out more money quickly. I think that was the right choice for the economy. We'll figure out the next stages together later when it comes to repayment. Next question.
Prochaine question, Hélène Buzetti, Le Devoir.
Hélène Buzetti, Le Devoir. Mr. Trudeau, thank you. I'd like to come back to the question put by my TVA colleague about the end to isolation. Quebec has mentioned herd immunity as the grounds for reopening schools. Dr. Tam does not agree. In your view, is Quebec's reopening of schools premature? There's still a lot of questions about herd immunity and individual immunity. As yet, there's no certainty that anyone who's had the virus will not catch it again a few months later. This virus is too new. We don't know enough about it yet. That is why we encourage everyone to be very careful about the stages they go through in reopening the economy, and that's why we've set up a task force on COVID-19 immunity across Canada. It will be based in Montreal, and it will conduct the research needed to help us understand immunity and to see how we can use it to best protect Canadians. This is, however, a medium and long-term project. For the moment, we need to be extremely careful. And I know that all provinces are being extremely careful in making sure that they reopen the economy in the right way. We don't want to end up going backwards.
that there is still a lot of uncertainty around the science of immunity, whether or not someone who has contracted COVID-19 is protected from contracting it again a few months later. That is still uncertain. There's a lot of research and science going on that topic across the country, around the world. We launched the Pan-Canadian Task Force on Immunity from COVID-19 just last week. So we have top scientists that are going to be working extremely hard to figure out what is the reality around immunity in Canada and how we can use it to keep people safer. But this is a work that will go on, it'll have immediate results in some levels, but it'll be a medium and long-term work that needs to be done. That's why we have to be very, very careful and cautious every step of the way in reopening the economy, because we don't want to come back to where we are. And I have confidence that every province is taking very seriously this responsibility to be careful, because nobody wants to have gone through all this for nothing.
Et en sous-question, M. Trudeau, vous avez mentionné que, mercredi, le Parlement resiège en personne.
Mr. Trudeau, you said that there would be an in-person sitting of the House on Wednesday or Thursday. You're going to be working on a bill for benefits to students. Is this bill going to be adopted and debated on Wednesday, or is there a problem with the opposition? We want the bill to go through. We shared it with the other parties over the weekend, and we're working with them, with the other parties, to make sure that the bill can be passed. It is an important measure. Everybody recognizes that. There are many students who will simply not have jobs this summer, and we need to support them during that period, not just so that they can pay their rent and groceries, but because we need them to remain in university and to pay their tuition fees next year. Looking after our young people means looking after our future. Last question, please.
Next question, City News, line open.
Hello, Prime Minister. You've been talking about federal guidelines for provinces to follow in terms of reopening their economy. We're expecting the plans from Ontario and Quebec. We've already heard plans from Saskatchewan and New Brunswick. When are you going to release the full list of federal guidelines? I know you gave some examples earlier, but the full list of federal guidelines, because, we have nearly half the provinces now releasing their plans.
We have been working with the provinces over the past weeks to develop a shared set of guidelines. These will not be federal guidelines. They will be guidelines that we agree to, all of us, the 13 premiers and the Prime Minister, all of our different orders of government, to inform ourselves going forward. It is something that is worked together to give Canadians a frame within which they can see the actions being taken in their particular regions. It is important, and it is historic, the level of collaboration between provinces and territories and the federal government, and that is going to continue. So we are continuing to work on finalizing those guidelines and hope to have them out in the coming days so Canadians can see them. But I can tell you that already the thinking that has gone into building those shared guidelines with the provinces and territories is already informing the decisions that they move forward with in announcing reopening plans.
Following up, Cormac?
And just wondering as well, you've announced commercial rent relief for small businesses, medium-sized businesses across the country. And Premier Doug Ford has also called for some sort of residential rent relief. Is that on the table for the federal government? Is it in the works right now with the provinces?
We recognize that Canadians need money for an awful lot of things, particularly when they no longer have a paycheck coming in, whether it's rent, whether it's groceries, whether it's supporting their family members. That's why we move forward rapidly on the Canada Emergency Response Benefit and the 75% wage subsidy that applications have launched today for. These are meant to replace income that Canadians won't have coming in over the course of this economic slowdown. And that can be used for rent, for groceries, for a range of things. If Provinces in whom the relationship between renters and landlords is their jurisdiction want to move forward with more help for residential rent. They can, of course, do that. We will focus on giving the benefits to Canadians that will replace as much of their paychecks so that they can pay their essentials. Small businesses needed extra support for their commercial rents on top of the wage subsidy, and that's what we've done.
Good morning, Prime Minister. Brian Mullen, Global News. One of the groups still feeling isolated and vulnerable are seniors. Many have had to absorb an extra cost of delivery services on a fixed income. Others have to pay additional dispensing fees at the pharmacy. Last week you said help was coming. How much longer will seniors have to wait?
We knew that moving forward on replacing people who lost and were counting on their paychecks through COVID-19 was the priority. And that's why we move forward with the CERB and the wage subsidy, which launches today. We then recognized that students who often start their summer jobs in early May after finishing their term at post-secondary education needed help as well, which is why we're moving forward on that. Seniors are also facing a tremendous level of vulnerability because of COVID-19. It is health vulnerability, it is being isolated further, challenges around mental health and isolation, and difficulty sometimes getting groceries and getting the supports they need. We have moved forward on a number of things to ensure that they get supports, but we're also looking at further supports specifically for the most vulnerable low-income seniors who are truly challenged.
Can you outline some of the options that you're looking at?
As I said, we're looking at things like supports for the most vulnerable seniors who are seeing extra costs because of COVID-19, and we will keep working on that and have more to say soon.
Hello, Prime Minister. Tom Parry, CBC. Municipalities have taken a big hit during the pandemic. Have you given any more thought to helping them? And if you do, how would that work with the provinces?
We continue to work with the provinces on the challenges that they're facing. We see municipalities absorbing many extra costs because of COVID-19. They are the responsibility of the provinces, of course, and we respect the constitutional division of powers in this country. But at the same time, we are looking for ways to make sure that municipalities have the necessary flexibility and tools to keep their citizens safe and to deliver necessary services. But those are conversations that we're ongoing with the provinces.
Can I ask you as well, when the economy starts to reopen gradually, you're going to have a lot of businesses that are going to be on the market for personal protective equipment. There's a high demand for it out there already. Are you making any kind of plans to deal with that?
Every single day, every week, we are ramping up our supplies of personal protective equipment. We have been ensuring that as much as possible, our healthcare workers, our frontline essential workers, get the equipment they need to keep themselves safe. But as we look at reopening the economy in different parts of the country, we know there is going to be an increased demand for personal protective equipment. That's one of the principles and guidelines we have to keep in mind as we look at reopening. Will there be enough PPE for various sectors to open up? And that's a piece of it. We are expecting to receive a shipment of PPE every day on flights from China this week. We are ramping up our domestic production capacities for personal protective equipment because we know that is going to be an important source for Canadian businesses and Canadian industry in the coming months. These are all things we're doing to make sure we can take the decisions that will gradually reopen the economy while keeping Canadians safe.
Bonjour, Monsieur Trudeau, Philippe Vincent Foisy de Radio-Canada. Sur la
Radio-Canada. On the emergency benefit and aid to students, will you make sure that there are more incentives to go back to work? Because at this point, if you're working, you earn $1,001, but you lose the $2,000. So you have to work many, many more hours to make as much as the CRB would give you. That's quite a disincentive to work. And it's having an impact. Will you adjust those benefits accordingly? We are in a situation where people have to isolate because of COVID-19. There are not enough jobs for Canadians across the country at the moment. We are quite aware of the incentive challenge or the disincentive challenge. We want to ensure that people who need workers will be able to get them, but there are millions of Canadians who will simply not be able to get a paycheck for work done. So we needed to support them. There are just not enough jobs at the moment. And there are just not enough jobs for students at the moment. So we have to support them, and that's a decision we had to make. Why not make the benefits more flexible so that somebody could get part of the benefit but go work in a long-term care home for part of the week, for example? Why not make it flexible? What we've been trying to do is help industries and workers in the right way. And we had to get these benefits out. We had to roll them out very quickly so that people could pay their rent and could go buy groceries, and so that they could make a choice of staying home when they had to and self-isolate when they had to, and thus protect our workers and colleagues in the healthcare system. If we had not given workers enough money to replace their lost paychecks, they would have had to jeopardize their own health in order to help their families, and all that would have done is prolong the crisis that we're in now. So we chose to act quickly and roll those benefits out reliably. Over 8 million Canadians are now receiving the CERB. And we know that any adjustment that made it more complex would have made it more difficult to roll it out quickly and reliably. So we chose quick and reliable and simple. That's what we did.
Over the last number of weeks, you've said that life will not return to normal until we get a vaccine. We asked Dr. Tam about those questions on the weekend. She said, and this is a quote, "It's very premature to comment on if we'll get a vaccine, and if we do, how effective it will be." So considering her cautious words on our ability to get a vaccine, is it still your position that life will return to normal only if we do get one?
Normal is something that is a long way off for all of us. And if we want life to get back to the way it was exactly before, it won't. There will be differences even a few years from now that we will have learned from dealing with this global pandemic that I think will be important lessons. As we move forward over the coming months, we will be able to see careful reopenings in certain sectors of the economy, certain things being allowed as people try to get back to something a little more like normal. But until we have a vaccine for COVID-19 or a system of treatments that are equivalent to a vaccine, where we can be sure that people will not will not have COVID-19 be as lethal as it is now, we are going to have to be very careful. That caution will remain, because at any time, if we loosen our measures too much, we could find ourselves back in a tremendous spike. Historians remember from the 1918 Spanish flu epidemic that the spring was pretty bad, but the fall was much worse. We need to stay vigilant every step of the way. And that's what we're focused on, so that this disruption to our economy, to our lives, that is difficult to go through right now, will not have been for nothing, and we will continue to keep ourselves safe for the coming months. Okay. Nous reconnaissons. Ce qui est normal.
I think normal isn't going to be back for a while. Life isn't going to be back to normal for a while. And even in 2-3 years, even after we have a vaccine, there'll be some measures we'll have taken as a society that will change us. We will likely not be the same society that we are now. We will continue to change, but we will be able to restart some activities in the coming months. It will be less difficult than this isolation we're in now, but we do have to be careful until we have either a vaccine or treatments that are the equivalent in a vaccine, treatments that keep us safe and mean that we can be less concerned about the spread of the virus. But until then, we're always at risk of a new surge if we're not careful. And if we don't follow the advice and recommendations of public health officials. Historians remind us that in 1918, the Spanish flu epidemic had a high incidence in spring. Spring was difficult, but fall was absolutely disastrous that year. And that's why we have to be careful, remain vigilant, and not end up having done all we've done so far for nothing.
The idea of a health passport, which would allow businesses and cities, other people, to determine, you would show whether or not you've had COVID-19. And I know you mentioned earlier that the science is still out on immunity and antibody tests, but the idea of Canadians having to show personal health information in exchange for going back to work, going back to school, is that an idea that you're comfortable with?
That is even premature to speculate about. There is no conclusive evidence right now that having contracted COVID-19 once protects you from contracting it again a few months later. This is too new a virus. Scientists are working very hard on exactly that, whether the presence of antibodies in someone will protect them from catching COVID-19 again. But we don't know that yet. That's why we have to be very, very careful, because if we make a mistake on this and allow too much loosening of our economy and of our restrictions, and we suddenly get another massive spike, it is going to be devastating, not just for our economy, but for people who will have gone through all these weeks of sacrifices and limitations for nothing. That's something we want to avoid.
It's much too premature to talk about immunity passports or immunity altogether, because we don't yet know whether someone who's had COVID-19 is protected from catching it again a few months later. Science is not conclusive on that. We may soon know, but we still don't. So it would be reckless to base our thinking on a notion of immunity when we don't know whether immunity is actually achievable. Thank you. That is the end of the press conference.
That is Prime Minister Justin Trudeau. We spoke about various things, including guidelines and frameworks and various provinces that these provinces are working on to reopen the economy. We're going to hear from Ontario today and Quebec in terms of how schools might reopen. But let's bring in Mike Lecouture from Ottawa. And Mike, toward the end there in the Q&A, you saw the Prime Minister searching for the right words, both in English and then again in French. And that had to do with life being back to normal. And it seems like he's still searching for answers to many questions he even has.
Well, yeah, and I think it also said that, look, even the scientific community is searching for these answers because COVID-19 is one of those viruses that we still don't know a lot about. And that was specifically, kind of throwing back at him what he had said, that all of this ends with a vaccine, that we'll get back to some sense of normalcy. But then Dr. Theresa Tam saying over the weekend that, even that is still a far way out, or that is uncertain. And the Prime Minister, I think, is sort of underscoring what everybody is thinking there and saying we still don't know enough enough. We're trying our best as we go, but trying to sort of couch it in saying that, this sense of normalcy will get back to a level of it, but then even indicating it might be years on when we talk about this and invoking the Spanish flu, saying we don't want to reoccur. We don't want something to reoccur like this, saying that in 1918 the spring was bad, but the fall was better. And that's why they're going so slow and trying to really figure out how to manage all of this.
Mike, let's talk about some concrete information. I only have a minute left, but people can't get the wage subsidy and get the CERB. What did the Prime Minister say in case people do accidentally or on purpose get both?
Yeah, and he's saying that, look, essentially that you'll have people from the Canada Revenue Agency who will be able to sort this out in the next fiscal year, but saying, look, just try and keep in mind that you may have to pay some of this back, and understanding that this is all new to everybody, so everybody just give them a bit of patience maybe. Okay,
Michael Couture in Ottawa, thank you. Just a quick recap of what the Prime Minister announced today. Since the application portal for the country's wage subsidy program opened at 6 a.m., almost 10,000 businesses have already applied. The first payments, by the way, coming on May 7th. The PM also spoke about collaborating on shared guidelines for reopening the economy. We have much more on globalnews.ca. We now return you to your regularly scheduled programming.
In Canada. There are now 47,327 confirmed cases, including 2,617 deaths. To date, labs across Canada have tested over 717,000 people, with about 7% of these testing positive. Another week is upon us, and I know that we're all weary, and the longer days and warmer weather are making us all feeling increasingly antsy. In fact, these past weeks have made the words of millions of kids ring true as they shout from the back seat, "Are we there yet?" I think I speak for all of us when I say we have never felt more like that kid, though I'm sorry to say no, not quite yet, and though we are getting closer all the time, we can't let go of the wheel yet. My reflection this past weekend was very much on the bigger picture. So when I think about where we are right now, with outbreaks in vulnerable settings and underserved populations driving the epidemiology of COVID-19, I am reminded of the critical importance of addressing inequities. This pandemic has exposed the fragility of some of our populations, especially those living in long-term care homes, group housing, those experiencing homelessness, or vulnerable Indigenous communities. It has also highlighted the basic subsistence challenges of those working in our essential services who cannot self-isolate, such as our healthcare workers and those growing, delivering, and stocking our food, medicines, and other vital supplies. The bad bugs are not going away, so if we are to end the tragedy of increased disease and death rates in vulnerable populations, we need to make things right now. This is not just someone else's problem or someone else's sorrow. Inequities touch us all. They affect the health and social well-being of all Canadians, just as they diminish our humanity. That means we need to look beyond the health system to the expanse of the public health, social, cultural, and economic fabric of our society. And this approach needs to be woven into both our cautious descent down the epidemic curve, as well as going forward to living with COVID-19. To put this virus in a corner where we manage it and not the other way around, we need to adapt our daily lives to the need for hand washing, physical distancing, and other control measures. And at the same time, we need to build protective supports into our social fabric to provide long-term protection against future waves of COVID-19 and future pandemics of emerging disease. Last night, Canadian luminaries from the worlds of music, sport, science, advocacy, television, and cinema brought us together virtually through the Stronger Together special. In addition to being extremely emotional and entertaining, it raised much-needed funds for food banks across Canada and allowed us to pay tribute to the heroic efforts of our frontline workers during this crisis. Stronger together is how we are going to get through this. Thank you.
Thank you very much, Dr. Tam. Et maintenant, je donne la parole à Dr. Howard New.
Now I give the floor to Dr. Howard New. Thank you. Good morning, everyone. First of all, here are the last figures on COVID-19 in Canada. 47,327 confirmed cases, 2,617 deaths. Labs have analyzed samples of more than 717,000 people, about 7% have tested positive. We're starting a new week, and we know that we're weary, and longer days and better weather is making us febrile. This week has given us a good look at the millions of kids who shout from the back seat, "Are we there yet?" I think I speak for all of us when I say we've never felt more like that kid. Though I'm sorry to say, no, not quite. And though we are getting closer all the time, we can't let go of the wheel yet. My reflection this past weekend was very much on the big picture. So when I think about where we are right now with outbreaks in vulnerable settings and underserved populations, driving the epidemiology of COVID-19, I'm reminded of the critical importance of addressing inequities. The pandemic has exposed the fragility of some of our populations, especially those living in long-term care homes, group housing, homelessness, or vulnerable Indigenous communities. It has also highlighted the basic subsistence challenges of those working in our essential services who cannot self-isolate, such as healthcare workers and those growing, delivering, and stocking our food, medicines, and other vital supplies. The bad bugs are not going away. So if we are to end the tragedy of increased disease and death rates in vulnerable populations, we need to make things right now, right now. This is not just someone else's problem or someone's sorrow. Inequalities touch us all. They affect the health and social well-being of all Canadians, just as they diminish our humanity. That means we need to look beyond the health system to the expanse of the public health, social, cultural, and economic fabric of our society. And this approach needs to be woven into both our cautious descent down the epidemic curve as well as going forward to living with COVID-19. To put this virus in a corner where we manage it and not the other way around, we need to adopt our daily lives to the needs of hand washing, physical distancing, and other control measures. At the same time, we need to build protective supports into our social fabric to provide long-term protection against future waves of COVID-19 and future pandemics of emerging disease. That's when we'll know we are well and truly there. Thank you.
Okay. Merci, Dr. New.
Thank you,
and now we
Dr.
will
New.
hear from our Minister of Small Business, Export Promotion and International Trade, Mary Ng. Mary, please.
Thank you very much, Deputy Prime Minister. Good afternoon, everyone. Bonjour tout le monde.
Good afternoon, everyone.
Directly today to small business owners and entrepreneurs in communities all across the country. You have worked incredibly hard to turn your idea into successful businesses. And for so many of you, that means having to miss birthdays, recitals, family dinners throughout the years. And for you, this is personal. And it's also personal for me, not only as the minister responsible for helping small businesses succeed, but as someone who grew up in a family-run business, I understand how devastating it must be to close your doors, struggle to pay your valued staff, or feel like you might have to give up on this dream that you've worked so hard to make a reality.
Our government is there for you.
As of today, you can now apply to receive the Canada Emergency Wage Subsidy that will cover 75% of your employees' wages, up to $847 a week. If you're a business of any size, a charity or nonprofit organization, and you've seen a drop in revenue for the months of March, April, and May, you can apply through your My Business account or the Canada Revenue Agency's online portal. Keep in mind that this benefit is retroactive to March the 15th, and it's available for a period of 12 weeks or until June the 6th.
We have worked hard to make this process as simple and efficient as possible.
All claims will be approved through the CRA's automated verification system, and your payment will be sent to you on May the 5th. We have partnered with banks and financial institutions to enroll payroll accounts for direct deposit, which means that businesses should begin to see money in their accounts as of May the 7th. For applications that require additional checks or more information from the employer, a secondary verification should take no more than 72 hours to complete. This wage subsidy will not only help save Canadian jobs, it's about keeping your teams together, which we know will be key to your success once we're on the other side of this and we are into recovery. Our team recently heard from a bakery owner in Atlanta, Canada. She will be using a 75% wage subsidy to pay for her 5 employees. In turn, this will free up the cash flow she has to pay for other operating expenses, including improving on an online ordering platform since she's had to close her doors. Simply put, this means relief for this bakery owner and so many business owners in every corner of our country, along with their employees. We're hearing of stories of resilience from this all over Canada, and our work is far from done. We're still listening. We will continue to do everything possible to support you, your businesses, your valued employees, and families across the country. Thank you. Merci beaucoup.
Okay,
thank you very
Mary.
I'd now give the floor to the President of the Treasury Board, Jean-Yves Duclos. Thank you very much. The main message by the Prime Minister this morning was one of assistance and mutual assistance in decision-making, first of all. So we want to underscore the extraordinary collaborative work of the provinces and territories and the federal government to properly develop shared cooperative decisions to guide us in important ways in the coming weeks by using considerable national expertise of scientists and researchers across the country, and expecting, of course, that this information, this advice will be applied locally by provincial and municipal administrations, and also to guide entrepreneurs and companies in this important exercise that they have to conduct in order to ensure the safety and security of workers in the coming weeks and months. Secondly, aid to essential workers that are often working for very modest wages. We want to thank them for everything they do for our communities and for all the people who need them. And we're very pleased with the progress in the discussions, as the Prime Minister mentioned this morning, between the federal government and the provinces and territories. And as Minister Ng just said, aid to employers to pay their wages. On April 11, just a few days ago, the House of Commons voted for the proper provisions to store this wage subsidy on April 21st, 10 days later. That is last Monday. We were able to launch a website that 300,000 companies visited in the last few days. Today, April 27th, 16 days after this was adopted in the House of Commons and adopted the regulations, we have the opportunity, thanks to the remarkable work of CRA employees, to ask companies companies to file for their wage subsidy. And as Minister Ng just said a few moments ago, as of May 5th, that is next week, answers will be provided to companies, and on May 7th, payments will start to flow and deposited. So that is because of the extraordinary collaborative work. And as President of the Treasury Board, once again, I want to thank all public servants who are working in very demanding conditions, both professionally and personally, for the remarkable work they do. And it's so appreciated because they're helping Canadians. Thank you.
Merci, Jean-Yves.
Thank you, Jean-Yves.
Of course, our Minister of Health, Patty Hajdu, is here as well and available to answer your questions, as are we all. Carl.
Thank you, Deputy Prime Minister. As usual, we'll start on the phone with 3 questions. 1 question, 1 follow-up. Operator.
Thank you. Please press star 1 at this time if you have a question. Please appuyez sur étoile 1 maintenant pour poser une question.
Press star 1 right now.
La first question est de Émilie Bergeron de l'agence QMI. À vous la parole.
Good morning. My first question would be for Mr. Duclos or Ms. Freeland. The Canadian Army is deployed in Quebec, has been there for several days to see what the needs are in long-term care facilities. So there's been a reconnaissance mission the past few days. Can we get more details today about how many additional troops will be sent to Quebec and when they will start to arrive? Answer. To begin with, we are fully engaged in organizing this deployment. This is the work of the Minister of National Defence and the Minister of Public Safety, Bill Blair. The work has already begun. By working with Quebec, 15 facilities have been identified as priorities, and 2 things are being done now. Reconnaissance of these establishments to understand what they need, and training of the Canadian Forces personnel doing this important work. And I want to add that this is work in which Quebec has the lead, with strong support from the Canadian Forces. There are also Red Cross volunteers that will play a very important role. In addition, we have volunteers that Health Canada's organized, and these volunteers will work with the Red Cross to do that work. Jean-Yves, do you have anything to add? Yes, very briefly. You've summarized the situation very well. Do a recall before we talk about the current situation. I think April 16th, the Thursday, a request was made by the Government of Quebec for the deployment of 125 members of the Canadian Forces who have medical expertise. And on the following Saturday, the members of the Canadian Forces were deployed. But that is a somewhat different context than the one we're seeing now. Now we're seeing the deployment of a larger number of members of the Canadian Forces. We're talking about 1,000. And people whose responsibilities and skills are not necessarily strictly medical. That's why the objective here, the prime objective focused on by the Quebec government, is that this deployment support the work of healthcare workers already in place and patients that are there. This personnel is not necessarily ready to deploy quickly and immediately. There is a preliminary measure, which is recognizance of the establishments and determining responsibilities. Follow-up question? Yes. While many provinces are unveiling their plans to reopen the economy, my question is for Dr. New or Dr. Tam. Wouldn't this be the right time to come out for or against wearing masks. If you consider this in the context of de-isolation, is it compulsory to wear a non-medical mask? Yes, thank you for that question. This is Dr. New. Dr. Tam and I continue to work closely with our provincial and territorial counterparts. We had a good discussion yesterday with the special advisory committee on this very issue. We do agree that there are principles that have to be maintained. We may make some public health measures more flexible, but we have to keep some principles such as physical distancing and proper practices such as frequent hand washing. We have to keep that. After that, we did agree on 4 criteria. Each province must have good evidence that transmission in their own jurisdiction is well controlled. They have a good capacity in their health care system, in their public health system, to properly diagnose all these cases, isolated cases. They have to do tracing and so forth. We know that every province and territory has their own epidemic. They may be in different realities with regard to their epidemic curve. So it's possible that one province is starting to find that it could relax its rules when others are not. With regard to the masks, this is still an issue. We continue our discussions. We know that it is another option, a good way for people to perhaps help protect others. It's always something we consider permissive because it's not really to protect yourself from others, but if you leave the house, perhaps it's difficult to maintain the 2-meter distance, for instance, in the grocery store or in public transit. So we continue to examine the science and probative data. Right now, that's where we are. Thank you. Thank you, Dr. New. Operator, next question, please.
Merci.
Thank
The
you.
next question, la prochaine question, is from Sharon Kirky from National Post. Please go ahead.
Oh, hi, Dr. Tam. You mentioned that over 700,000 Canadians have been tested with about a 7% confirmed positive. But there are concerns that the swab testing, the RT-PCR testing, has a high false negative rate because, it can be tricky to get a decent sample. I'm wondering, what does your data show about the prevalence of false negatives?
So I think the PCR tests in general actually have a good specificity and quite a high sensitivity in general. But I think you've just mentioned that taking a swab is not a completely simple procedure. You have to take it using the right technique at the right time, etc., to detect the virus. And I know also that sometimes people need to have more than one test taken if there's some degree of suspicion that someone actually has the virus but was tested negative the first time, will then perhaps need a follow-up test as well. So I think, absolutely this is a potential issue. We do know that, of course, we do not have a full accounting of all people infected in Canada, and that is part of the work that we'll be doing as part of the immunity task force as well, to actually ascertain what level of infection has actually occurred in Canada.
Follow-up?
And that was going to be my follow-up. Sorry, that the NIH and CDC have started the serological testing to try to get some kind of handle on who's been exposed and what kind of immunity levels there might be. I'm wondering what assumptions you're working with when thinking about what proportion of the population has already been infected. Is it 10 times the number of confirmed cases, 50, 100? I'm wondering what assumptions your agency is working with.
Well, I think that is the part of the work going forwards to actually determine through different methodologies the different areas of Canada, maybe the hotspots versus the ones that didn't have as much reported cases, the age group structure, so all of that, it will be part of the forward-looking design. Some jurisdictions are also already planning these studies to answer specific questions. So exactly the type of question that you're asking as well. We also are looking at a design that is more longitudinal because of some of the serologic tests are not necessarily, again, have the high enough specificity or sensitivity. And so by looking more longitudinally, even if you didn't detect something in the first time, maybe you will detect something at a later date as well. So all of these questions are part of the, will go into part of the design of the studies going forwards.
Thank you, Dr. Operator. Next question, please.
Thank you. The next question, la prochaine question, est de Lina Dib de la Presse canadienne. À vous la parole.
Canadian Press. Question. Ms. Freeland, we get the impression over the weekend that Quebec and you did not have the same understanding of herd immunity. So I'm wondering where things stand. Do you now believe that the Legault government and you are on the same page? That they also understand the concept of herd immunity and its usefulness right now? Answer. Because this is a scientific question, I will ask Dr. New or Dr. Tam to answer you. I'm sorry, but I don't want to have herd immunity explained to me. My question is political. That's why I'm asking you. Do you believe that Quebec understands the same thing you do? Lina, could I ask Dr. New to answer, and then I'll be very pleased to answer in my behalf. Thank you. This is Dr. New. Thank you for your question. I think that in the scientific community, public health health directors in all provinces and territory, and me, I've had good discussions with Dr. Arruda, and I think that from a public health perspective and scientific perspective with probative data, we don't have any conclusions right now. We know that people who have already been infected will have an antibody reaction. But the question is, we don't know whether that reaction provides immunity, and if it does, for how long? How long will that last? Is it a few weeks, a few months, maybe for life? We don't know, because we do have evidence from other countries that people who are already infected had a second infection, were reinfected. So that's some indication that an infection does not give you immunity. If you're talking about herd immunity, or collective immunity, I don't think that we can use that to manage this pandemic, because the evidence is not there right now. So we have to continue to follow the scientific evidence and data. Dr. Arruda in Quebec and we have had a good discussion at our Special Advisory Committee, and everybody agrees. We have to follow science. Thank you. Okay, Nina, as I promised you, I will give you a political answer now. I'm neither a scientist nor a doctor, but I do know that the federal government and all the provincial premiers and territorial premiers agree that we have to follow the advice of our doctors and scientists. As Dr. New just said, we have an advisory council where all directors of public health across Canada talk talk to each other and exchange views and exchange ideas. That's a very good thing. And I know that discussions at that level among doctors and scientists in Canada is a very collaborative and open one. They talk very often. Now, with regard to reopening, that is a very important question. On Friday, we had good discussions between the Prime Minister of Canada and the provincial and territorial premiers. We're getting an agreement on the principles that will guide reopening for the whole country. And I can assure Canadians that the process will be gradual, it will be collaborative, and I know that in all of Canada, the process across this country that is so huge, so vast, the process will be guided by science. Thank you. Follow-up? Yes, thank you. My follow-up would be for Mr. Duclos. I don't quite understand why this can't be deployed more quickly, these 1,000 military personnel. It can't be faster. Why can't it be faster? Well, let me point out, it is rapid, but there are different issues compared to the first deployment, where there was a smaller number of members of the Canadian Forces that were called to serve, but they had initial skills that were different. It was more restricted group. They were medical technicians deployed in these long-term care facilities. So now the demand is broader, the numbers are bigger, and the number of establishments is larger too. That's why this deployment is done differently from the first one. Thank you, Minister.
Taking questions in the room. Julie?
In CBC. My first question is for Dr. Tam. Considering what the WHO said, that you can get COVID-19, you can recover from it, and then it doesn't make you immune from getting it again, were you surprised by that, and how much of a setback is it?
Actually, I don't know that we know the full answer to that question. I think we know that people who are infected with COVID-19 will develop some kind of antibody response. And that will probably provide some level of protection. We just don't know what level of protection, how strong that protection is, and how long it will last. I think that's the sort of scientific discourse right now. So that's why those studies need to be done, and that we should be cautious about how we interpret the results, for example, of some of the serologic testing. But I know that so many countries in the world, and now including Canada with the Immunity Task Force, we're going to try and get to the bottom of those answers. But right now, we just don't have enough information.
Okay. So I'll just make a little comment, then I'll go to my second question. So it doesn't sound like you agree with the WHO, but now my second question. And that would be for Patty.
I don't think that's correct.
No?
No, I think what Dr. Tam, I think what the WHO has said is that we don't know for sure what's happening, and I think that's what Dr.
I think
Tam
globally we're
on.
including the WHO, but all the scientists around the world are just trying to gather this information. We can base some of the knowledge about past knowledge of infections with certain respiratory viruses, but that doesn't mean it's the same with COVID-19. So I think we're still trying to discover the answer to those questions. I do think we expect some level of immunity. Just again, how strong that is and how long it lasts is unknown. And but we will get to some of these answers with these studies.
And if I can just add, I think my interpretation of what the WHO is saying is that to be careful, those countries and jurisdictions that are thinking that you could issue an immunization or an immunological passport. It was in response. I mean, look, at countries all around the world are trying to figure out a way out of this, and rightly so. And I think the warning from the WHO is exactly as Dr. Tam has said. It's far too early to be giving out any kind of certificate that says, oh, you've had COVID and therefore you are now immune, because that is a dangerous line of thinking when we haven't the science yet caught up to what the evidence actually says. And so it's very important, I think, to all citizens who've had COVID to know that there's a caution around assuming just because you've had it that, in fact, you are now protected. And that is exactly why we have an immunity task force in Canada, and many other countries are studying serological prevalence so that we can understand, first of all, what the extent of exposure is, but also what the extent of immunity is. Both very important questions.
Julie, follow up?
Thank you for being so fulsome on my first question.
Provoked us, Julie.
The second question is about testing. I'm not sure if it's for Dr. Tam or for Patty Hyde, but we know that testing is very important in terms of reopening economies, and we've had problems with testing in terms of lack of swabs recently in the past couple of weeks, backlog of cases in Ontario and Quebec and other provinces. I'm wondering if it's resolved to your satisfaction, and considering that economies are starting to talk about reopening within the provinces very soon.
I'll do a two-part answer again with an overview and then turn to Dr. Tam about the conversations. I think obviously Canada can do better, and we've done a lot, and we're very happy with the growth of testing that's happening and the capacity of provinces and territories to increase capacity of testing over the last several weeks. Part of that is domestic production of some of the equipment that you've mentioned, including something called reagent, which is essentially the chemical, the fluid that is required to complete the testing, and now we have a local manufacturing source for that reagent, which is making it a lot easier for provinces and territories to get that component of the testing done. But there is more to do, and of course, I will also say that testing is one layer of what I would call a health safety net that we will need to be putting into place so that provinces, territories, and communities can, in fact, get back to the new normal, or arrive at the new normal, if you will. That testing strategy has been evolving, and we're extremely encouraged by the work of the provinces and territories as they've looked for innovative ways to resolve many of the challenges, some of those that you've identified. And I'll turn to Dr. Tam. Maybe you can speak a little bit about the special committee's work on testing.
Yes, and it will keep on undergoing evolution as we move into a next reality, if you like. So right now, I think many jurisdictions are still increasing the capacity, and including Ontario and others, have really ramped up the testing. And broadening testing, of course, to focus on, say, long-term care homes, because systematically testing all of them and much more widely is very, very important. So you see some of the rise in numbers as a result of those systematic testing approaches. And in terms of some of the going forwards is make sure we widen our testing criteria, certainly to look at a broader array of symptoms, even mild symptoms. Right now, actually, very few people are showing up to be tested, given that we are not getting the respiratory illnesses. So I think looking at how we still broaden the net while people are actually not showing up with illnesses as well. And really make sure that any outbreaks, as I said, as we descend down the epidemic curve, is to be able to rapidly identify cases, their contacts, and any kind of outbreaks, particularly in vulnerable settings where you have to actually cast the net wide in terms of testing, are some of the areas for sure as we go forwards. But I think we are continuing to evolve the strategy right now, and it all involves actually increasing capacity. And I think we're all looking to plan for all eventualities, for example, what might happen next winter. So I think making sure we gear up and be prepared. It is a very, very dynamic situation and very complicated from every aspect of the sourcing of these different components of the lab testing. But I think that we're pulling out all stops, including domestic, options. So I think we're working all towards increasing lab capacity for sure.
Thank you, Dr. Tonda McCharles, Toronto Star.
Thanks. Dr. Tam, on Friday, you talked again about the need to be extremely cautious in the reopenings. And one of the factors you talked about was your concerns around importation. And I want to understand what you were talking about there and what now that you've seen that the U.S. has nearly a third of global cases, what is your concern there, and how soon do you think that that border can be reopened?
So, Todd, I'll start, and then I'll turn to Dr. Tam in terms of that. Everything that we do in the next phase will be done carefully, and in terms of the relationship with the United States and partnership with the United States. And I thank the Deputy Prime Minister and many others for their hard work on making sure those relationships stay strong and that we can have those conversations. That is part of the work that we're doing now as a government, is to sort out how we do a better job when we begin to see an increase in travel, whether it's Canadians going abroad and then coming back, which they will always have the right to do, and how we manage those reentries carefully so that we can continue to prevent numbers of cases from arising from countries that perhaps don't have a very good handle on what's going on in their country from an infectious perspective, or that maybe have outbreaks that will create a health and safety concern for Canada. But I can maybe turn to Dr. Tam about some of the conversations around borders that are happening at the committee.
Well, we will be extremely cautious about doing any changes to our international public health approach. It is dependent on looking very carefully at the what's happening in other countries for sure. But our sort of approach, though, is to make sure we get what is inside Canada well managed, well controlled, and moving towards that new living with COVID-19 as the primary step before we can consider what we need to adjust from an international perspective.
And I noticed today you haven't, at least a little while ago, the websites hadn't been updated with the new infections picture in Canada. Yesterday, new cases seem to have picked up a bit. And I am unclear on what the national picture is. You say all the provinces manage their own data, but in the federal government gets that data. You are not releasing provincial data. I'd like to understand, what is the national picture right now from your perspective? Have we successfully flattened the curve? Where are we on the curve? And have you asked the provinces to allow you to release their data, or are they telling you you're not allowed to release their data?
So we have been publishing the national picture and updating it every day. So in terms of our website, what we do want is a sort of deeper dive into more details as it pertains to the different cases that have been reported. So you will see the map of Canada, you will see the numbers that are updated in real time, as well as, of course, the tragic deaths that have been reported as well. What we do want to get to, and I think we are improving as we go along, is a deeper dive onto the actual knowledge of who is most severely impacted. I mean, we all know long-term care facilities and certain at-risk populations are impacted, but we do need more granular data on some of that for sure. I think that, interestingly, from my perspective, it is, I would say, part of the stronger together theme, actually, when I was thinking about it, is that from a public health and chief medical perspective, partnership is strong. But we have to invest in our public health capacities and infrastructure, and how we do data collection and sharing in a way that is more efficient for the front line who are busy trying to work on all sorts of things while still getting the national data that we need. So I think there's a lot of room for moving forwards to really enhance that. And I certainly hope that, as we get through this pandemic together, we don't forget public health and the need for public health and what that capacity requirement is to provide something as what people think is simple, which is data. Data comes from many different sources, from healthcare, from labs, from public health. All of these are important. They need to come together, and we need to look at the most efficient way that we can do that. and it is an area that we need to address. We do have a differential picture going on across the country, with some provinces that do not have community transmission that has managed not to have it, some that have had some community transmission and that are getting addressed. But of course, the 4 biggest provinces where most of the cases are coming from had a slightly different stage in the epidemiology, and they've been reporting out on that as well. So that does impact some of the details and the planning of that next phase, and you will hear the sort of details from each of the individual provinces as well. We at the Special Advisory Committee level is looking at a broader set of criteria of how jurisdictions could go about moving into that next phase.
Thank you, Dr. Mike.
Thank you. Wood Buffalo has asked for military to assist in evacuations because of flooding and stuff. Will the military be made available to help with this situation?
Thanks for the question, Mike. And we are aware of the flooding in Fort McMurray and are looking right now very urgently at ways that we can help. As we have known from the outset, the fact that flooding season and in due course forest fire season is coinciding with coronavirus in Canada is posing some special challenges. We have been gearing up for those from the outset, and this is an issue that we are looking at urgently today.
Okay, could you help me understand what the federal's government's plan is to help in these secondary emergencies for municipalities and provinces and wherever they hit during this pandemic?
You know, every year in Cabinet, when spring comes for any Canadian cabinet, one sign of spring is that the Minister for Public Safety and Emergencies briefs Cabinet on plans for flooding and forest fires in that season. This year has been no different, with the exception of the reality that our government has appreciated from the outset that a response to flooding and in due course forest fires will be complicated by the reality that it overlaps with the response to coronavirus. So we will respond as we always do. We are very aware of the situation in Fort McMurray and are working on that right now.
Thank you, Deputy Prime Minister. We'll just take one question on the phone and one last question in the room. Operator.
Thank you. The next question, la prochaine question est de Micheline Laplante de Radio-Canada. À vous la parole.
The next question is from Micheline Laplante of Radio-Canada. Thank you very much. Good afternoon. Many provinces are preparing to end the lockdown. Many industries and services will need personnel, and often it's at minimum wage. Given that, how can you make sure that your aid programs won't deter Canadians from going back to the labor market? What is the strategy to manage the economic reopening? Thank you very much. Answer. The strategy is about direct aid to workers who lost about everything in many cases, and aid to companies to pay and rehire employees. So that's quite a general strategy because it also applies to students that we've been talking about for many days. We want to recognize that there are millions of Canadians, and young people in particular, who need assistance right now to get through this crisis. And in the case of students, to help them go back to their studies. We want to avoid, if you allow me to open a parenthesis, we want to avoid cohort shocks on the ability of young people to continue their studies and develop, to flourish, because they're allowed to have a solid career too. Generally, it's through the Canada Emergency Response Benefit for those who've lost their jobs, but also we want to help through the wage subsidy that we announced again today. We want to keep our workers. We need those workers when the economy resumes. Micheline, follow-up question. Mr. Duclos, my question concerns companies that say that I'm having difficulty recruiting people because people prefer to get the CERB rather than a few hours that they could get to work to increase their pay. So are you going to eventually adapt this assistance programs and amend the CERB to adjust it to the labor market so that companies that want to operate can do so and get full-time staff? Well, one thing we're doing right now is working with the provinces for all low-wage workers working in essential sectors in Quebec and the rest of Canada, and that includes a lot of industries and companies. So we're in contact. We're working very hard with Quebec in particular to help Quebec continue to invest in essential sectors of the economy so that employers can continue to offer incentives to continue to work in this context. Thank you, Minister.
From CTV, Dr. Tam, my first question's for you. When COVID started, cruise ships were the big issue. Lots of Canadians were on cruise ships. We had to get them off the ships, put them into quarantine in CFB Trenton. And we determined that that was the best way to deal with people not spreading the disease and staying healthy. Why have we not applied similar logic to getting people out of situations where it was bad, like it is in long-term care homes now, and getting seniors out of long-term care homes and moving them into either hospitals or other quarantine sites to make sure that seniors in these long-term care homes who aren't infected don't get infected?
So yes, the cruise ship as a very high-risk situation was something that we had to deal with, and even the concepts of how we manage them might be changing as we speak as well. I think, again, provinces and territories, as well as the organizations that looking at, actually responsible for long-term care homes, are looking at all of those options. It is actually quite difficult, of course, to move some of the patients out, and looking at whether you move. It's actually quite complicated in terms of the needs of these populations. So you do have to have settings that are appropriate if you were going to move anyone at all. But I do know that some jurisdictions are actually already looking at some of those models. But prevention still is absolutely key. I think we're learning about how to, test very widely when an outbreak occurs so that you can potentially cohort and know who to move where, because you may not actually know unless the testing has been done as well. So I think all of that is the sort of collective learning, and that's going on kind of right now, I think.
Second question, it's a two-parter. I want to ask about sports. So there's lots of Canadians at home who would like to watch a hockey game or football. Dr. Tam, for you, there's many leagues of the NHL right now. There's reports saying that they want to come back in July, having 4 cities where teams would congregate there and they'd play without fans in those situations. Do you think this is a good idea? And what medical steps do you think leagues need to put in place to make sure that safety of the players and the other administrators in there? And for Ms. Hyde or Ms. Freeland, considering that there are so many other issues going on in society writ large right now, do you think that it is appropriate for sporting leagues to restart playing when things are going on?
Maybe we'll reverse the order, and I'll do the sort of political overlay and then turn to Dr. Tam. I think the sporting sector is not unlike many other workplaces, and I think the next step, as we talk about how we return to the new normal or approach the new normal, is the deeper dive on workplace settings and how workplaces, whether it's you're a member of a sporting facility or you're a team, or whether you work in a meat packing plant, or whether you are working in retail and you have a very small shop, all of those kinds of thoughts are going to happen rapidly. Certainly at Health, we're turning our mind to thinking about how we can support that deeper dive for all kinds of employers and sectors to look at how they change their practices and build in the safety that will be needed, not just for the safety of their workers and themselves, by the way, but also for the business continuity. Because you could imagine if, for example, 4 teams decide to come together and have a regular series of games and 1 or 2 people have COVID COVID and they're not very symptomatic, how quickly it could take out all 4 teams. Those are the realities, no matter what sector you're talking about. And so I see professional sports much like the same as any other sector. There will have to be considerations that are based on science, that are worked out with the employer and with the employees in this case, to make sure that the people in that sector are kept safe and that the people that are interacting with that sector are kept safe as well. That's not easy. And I think your question around sports is a particularly profound one, because there is a high degree of contact and a high degree of exhalation and a high degree of sort of potential of droplets, if you will, spit and all kinds of stuff, entering each other's bodies. And that makes that particular sector very challenging. Dr. Tam, I don't know if sports has come up for you, but perhaps it has.
Not just yet in that specificity. I think some of our initial sort of first cautious step is ensuring that people can get outside and get the type of physical activity that they need while maintaining public health advice. And so, but I think in terms of different sectors, we provide certain parameters. You can do a risk assessment, of course, of the different sectors, as in the number of contacts, the intensity of contacts, the ability for them to adapt. But also, I mean, from our perspective, think wider than those teams. They're connected to families, and the families are connected to communities. So you need to actually think of the risk assessment as not just beyond what is happening inside the game. So I think that's really important. So I think our approach also is, given certain public health requirements, will they be able to come up with a plan that would meet them? So I think the idea is to encourage people to think ahead, submit their plans to public health, and see who would actually meet public health requirements. But I have to admit that we haven't actually specifically talked about that setting as yet.
OK. Ceci met fin à la conférence de presse d'aujourd'hui. Merci.
That concludes today's press conference. Thank you.